Imagine being able to peek inside the human body without any incisions or X-rays. That's precisely what ultrasound technology allows us to do. Ultrasound, often referred to as sonography, is a safe and painless imaging technique that uses sound waves to create pictures of our internal organs, tissues, and even a developing fetus during pregnancy. Unlike X-rays, which rely on radiation, ultrasound utilizes high-frequency sound waves that are emitted from a small device called a transducer. These sound waves travel through the body and bounce back, or echo, when they encounter different tissues. The transducer then captures these echoes and converts them into images displayed on a monitor. Think of it like a bat using echolocation to navigate in the dark. Just as a bat emits sound waves and listens for their reflections to determine the location of objects, ultrasound machines use sound waves to see inside the body. The different echoes produced by various tissues create a visual map, allowing medical professionals to assess the size, shape, and overall health of internal structures. This remarkable technology has revolutionized the field of medicine, providing invaluable insights into a wide range of conditions without the need for invasive procedures. From monitoring pregnancies to diagnosing diseases, ultrasound has become an indispensable tool in modern healthcare. The magic of ultrasound lies in its ability to transform sound waves into detailed images. The process begins with the transducer, a small handheld device that plays a pivotal role in both emitting and receiving sound waves. When the transducer is placed on the skin, it emits high-frequency sound waves that penetrate the body. These sound waves, inaudible to the human ear, travel through different tissues at varying speeds. As they encounter boundaries between tissues, such as between muscle and bone or between fluid and soft tissue, some of the sound waves are reflected back to the transducer. The transducer acts like a sensitive microphone, picking up these returning echoes. The time it takes for the echoes to return and their strength provide crucial information about the depth, size, and composition of the tissues being examined. A specialized computer within the ultrasound machine processes these echoes, converting them into real-time images displayed on a monitor. The resulting images are grayscale representations of the internal structures, with different shades of gray representing varying densities and textures of tissues. Ultrasound's ability to visualize the inner workings of our bodies has made it an indispensable tool in diagnosing a wide range of medical conditions. From detecting tumors and gallstones to evaluating blood flow and monitoring pregnancies, ultrasound provides valuable information that aids in accurate diagnosis and treatment planning. One of the most common uses of ultrasound is in monitoring pregnancies. Ultrasound scans allow doctors to visualize the developing fetus, monitor its growth, and detect any potential abnormalities. The images provide insights into the baby's size, position, and the health of the placenta. Ultrasound is also highly effective in diagnosing conditions affecting the abdominal organs, such as the liver, gallbladder, pancreas, and kidneys. It can detect tumors, cysts, stones, and other abnormalities in these organs, allowing for early diagnosis and intervention. In cardiology, ultrasound plays a crucial role in evaluating the heart's structure and function. Echocardiograms, a specialized form of ultrasound, provide detailed images of the heart chambers, valves, and blood flow, aiding in the diagnosis of heart defects, valve disorders, and other cardiac conditions. Section 4. A gallery of discoveries, ultrasound images and their significance. Ultrasound images, though seemingly abstract at first glance, provide a wealth of information to trained eyes. These grayscale representations offer valuable insights into the size, shape, and texture of internal organs and tissues, aiding in the diagnosis of various medical conditions. In obstetrics, ultrasound images allow medical professionals to monitor fetal development, assess gestational age, and detect any potential abnormalities. The images reveal the baby's position, the amount of amniotic fluid, and the health of the placenta. For diagnosing gallbladder disease, ultrasound images can reveal the presence of gallstones, which appear as bright white objects within the gallbladder. The images also help assess the size and shape of the gallbladder, indicating any inflammation or blockage. Ultrasound is also valuable in evaluating kidney health. The images can detect cysts, tumors, and kidney stones, providing crucial information for diagnosis and treatment planning. By understanding the significance of different shades, shapes, and patterns in ultrasound images, medical professionals can accurately diagnose and monitor a wide range of medical conditions. Section 5. Deciphering the shades of gray. Understanding ultrasound images. Ultrasound images, with their varying shades of gray, might seem like abstract art to the untrained eye. However, these shades hold significant meaning, representing the different densities and textures of tissues within the body. Understanding how to interpret these shades is key to unlocking the wealth of information contained within ultrasound images. In general, denser tissues, such as bone, reflect more sound waves and appear brighter or whiter on the ultrasound image. This phenomenon, known as hyperechogenicity, creates a stark contrast, allowing for clear visualization of bony structures. Fluid, on the other hand, appears dark or black on ultrasound images. This is because sound waves travel easily through fluid without much reflection, a characteristic known as anechoic. Amniotic fluid surrounding a fetus, for instance, appears black, providing a clear contrast against the developing baby. Tissues with intermediate densities, such as organs and muscles, fall somewhere in between these two extremes. They appear as varying shades of gray depending on their composition and the amount of sound waves they reflect. For example, the liver typically appears slightly darker than the spleen, reflecting their different densities. Medical professionals undergo extensive training to recognize and interpret these subtle variations in shades of gray. By analyzing the patterns, shapes, and relative echogenicity of tissues, they can identify abnormalities, assess organ function, and monitor the progression of diseases. Section 6. Ultrasound and the Big Reveal, Boy or Girl. Beyond its diagnostic capabilities, ultrasound has become an eagerly anticipated event for expectant parents eager to learn the sex of their baby. Fetal ultrasound, typically performed around 18 to 20 weeks of pregnancy, can often reveal the baby's sex with a high degree of accuracy. Determining the sex of a baby through ultrasound relies on visualizing the developing genitalia. While not foolproof, experienced sonographers can often identify anatomical differences between male and female genitalia with a reasonable degree of certainty. In male fetuses, the ultrasound image may show the scrotum and penis. The presence of a turtle sign, where the scrotum and penis resemble a turtle's head and neck, is a strong indicator of a boy. In female fetuses, the ultrasound image may reveal the labia and clitoris. The absence of male genitalia and the presence of 3 lines representing the labia majora, labia minora, and clitoris are suggestive of a girl. It's important to note that the accuracy of gender determination through ultrasound depends on several factors, including the baby's position, the clarity of the image, and the experience of the sonographer. While ultrasound provides a glimpse into the developing baby's sex, it's essential to remember that the most important aspect is the baby's health and well-being, regardless of gender.